we apologize for being late. We had some little itches. So I am Omubo-Pepple Dabota. I'm your moderator for today. And this is the third day for the Sickle Cell series on mental health, which is Rethink Mental Health Living with Sickle Cell Disease. Talk about it. So today we'll be talking about a very important topic that has to do with people living with sickle cell. This is one of the topics that a lot of us shy away from. This is one of the topics that we try to avoid and try to act like it doesn't exist, but it actually does exist. So today we'll be talking about dealing with substance abuse and addiction. And with us here today is Dr. Ugonna Ibaewuchi. She's a fellow with the West African College of Physicians. She is a mental health physician. That simply means that she is a specialist in the mental health specialty or field. She has a broad knowledge of our topic today, and she has also had lots of experience managing people with this condition because she has also worked in the drug and rehabilitation unit in UPTH. So she's like the perfect fit for this section today. So she's going to be walking us down the professional line on what this topic is about. And then after that, we're going to have question and answer section discussions. I'm going to ask her certain questions, and then she's going to explain to us. So for now, you could drop your questions in the chat box. I'll pick them from there and ask while I hand over the stage to her. So Dr. Ugonna, you can take over.
Hi, everyone. It's really nice being here today talking with all of you about this very important topic. I couldn't say no when she asked me to talk to you because she's somebody I actually admire because of her passion for what she believes in and does. So it's a pleasure to be here. Today, I'm talking about dealing with substance use and addiction. And it's actually a very important topic because globally right now we're having lots of problems with substance use everywhere. And for a way of introducing the topic, I would like to say what really are psychoactive substances, what are psychoactive drugs. So everybody has their own conception of what these things are, but they are substances that work on your brain and your central nervous system. And when you take them through whatever means you do, they tend to affect your mental processes, perception, how you perceive things, your consciousness, your mood, and emotions. All these psychoactive drugs, they generally all belong to a broader category. So when you hear us in the context of what we're talking about today, talking about psychoactive substances, we mean all these drugs, including alcohol and nicotine. So it's like broadly everything really that can affect your brain and central nervous system. And for addiction, there's been many definitions of addiction over the years, but it's come up to be modified in recent times. And I think this is a more accurate depiction of what addiction is. It's a chronic relapsing brain disorder. Why is it chronic and relapsing? Because really, we'll get to that, but people usually just start off using drugs for whatever reason, recreational, or it could just be whatever reason they choose, but nobody plans to end up here at the end point, which is addiction. So it's a chronic relapsing brain disorder that is characterized by compulsive drug seeking. Like some people think they have control, but they really don't because you're neglecting every other thing you're doing just to seek out this drug to use. And even when you're seeing the harmful consequences that it's having on you, it's like you're at the point where you can't do anything about it. And unfortunately, the changes and the impact it has on your brain is actually long lasting. And even with treatment and with people going on, sometimes that's why we are defining it now as relapsing because it's like you make giant strides because of that scar it's had on your brain. You find yourself sometimes relapsing. So that's basically what addiction is. Like I said at the beginning, it's not something anybody should shy away from right now because it affects everyone from all walks of life. It doesn't matter your socioeconomic status, where in the world you are. The drug pandemic is everywhere now, it's real, and everyone is actually coming together to find a way to combat the impact because everyone is beginning to see what it's doing to the younger generation. Like I said, no matter what the reason was you had starting it, the end point is that people get to the point where they're now addicted. And then before they even realize it, and that's where it's really a big problem. So when you have a full-blown disorder, it's extremely difficult stopping it on your own. It's not that it's impossible, but it's just that at this point, you really need help from people who are more equipped and trained in this field to help you get through it. And if it's something that you keep pushing away and you keep neglecting, there are many instances where the outcome becomes very deadly and it's a huge loss to everyone. Globally, it's estimated that there's 305,800 babies born with sickle cell disease worldwide. And from the statistics, nearly 75% of these births are in sub-Saharan Africa. So nobody needs to tell you that we have a huge burden of sickle cell disease in South, and that's why, and unfortunately, we don't have the much deserved access to medical care and public health strategies to decrease the mortality and morbidity from here. And it's unfortunate because of course, everybody who is in that environment understands why the poverty, the socioeconomic gap, the governments that are not doing enough at all to make these things available, which is why we should be talking about these things. According to United Nations Office of Drug and Crime, it's estimated that 246 million people, that's 1 in 20, between the ages of 15 and 64, used an illicit drug in 2013. And this number has climbed up steadily, even and is more obvious because of the growing world population. The magnitude of the problem becomes apparent when you're now saying that 1 in 10 drug users has a problem. It's not just that they've used it, or 1 out of 10 who have used it now have a drug use problem, which is huge. And, like it cuts across everything. It's not just that you have the impact it has on everything you do is actually overwhelming. So, like, picture it this way, like the statistics, some 27 million people, almost an entire population of the country, the size of Malaysia. That's huge and is significant. And then again, 12.19 million of these people are injection drug users. And of course, the population with HIV, we're not even discussing that of that population, the ones that who have become suicide statistics. So all round, it's actually a big problem. Coming down with people who are living with sickle cell disease, 10% have been reported to abuse drugs, especially the opioids. So it's a big problem. What are the risk factors? Everybody talks about substance use. It's something we talk about all the time, but there are different ways to look at it. But just summing up simply, I put it at personal level and environmental. Personal is everything that affects you as a person. So it goes all the way to your genetics. Unfortunately, science is showing us that about half of the problem, the substance use, the genetic tone to it, family history of substance use, mental disorders, you're having a current mental health problem, which most people do not even realize that they do because our mental health is largely neglected. Then having chronic medical conditions, chronic pain, low involvement in school, history of abuse in any regard, be it physical, sexual, emotional neglect, family conflicts, and having poor coping methods. At the environmental level, now you can talk about peer pressure, stress. Stress is a huge word. Anything can lead to stress. It can be financial, there are just so many things, but as a whole, whatever it is that at the end point is stressing you out as an individual is a risk factor that can predispose you into substance, especially if you eventually fall down the line of having dysfunctional coping methods. Early exposure to drugs in our environment is common. You see people who have had exposures because, which I would still take back to neglect, because at the stage where they were exposed to these things, the people who should have looked out for them really didn't do a good job. Prescription medications, access. In Nigeria, for example, we know what happens. It's not as controlled as it should be, and which is bad because then anybody is easily accessible to whoever, and at the end it becomes a problem. The advertising, particularly to the youth through peers, conflicts and support. So that's like a simple way to sum it up, like what the risk factors are, but you can group it in however way you look at it, but generally, broadly, these are the problems. Then, particularly in sickle cell disease, I'll talk about pain management. Why? Because it's a problematic issue. You cannot deny the fact that people have recurrent painful episodes. You can't downplay that, and it's a problem. And you have to prevent it, you have to treat it. And again, at the end of it all, pain management, where it's done well, yes, it's good, you relieve the symptoms, but in our environment, particularly, research now has suggested that some patients with sickle cell disease that were treated with opioids, that's actually the pathway where they learned about opioids, the dose that reduced or that minimized their pain. And then this knowledge for a good number of people becomes a problem, because then you have them self-medicating, misusing prescription drugs, and at the end of the line, they are now getting into substance use problems and down, as well as addiction. Then poor help seeking behaviors. It's common, it's not just with any population, it's generally a problem with the populace. Most people do not want to seek help. They don't even want to admit that they have a problem. For many reasons, stigma, we're still battling with it. We're still trying to get people to see that no, everybody's talking about this thing. There's nothing to be ashamed of. But for whatever reason, all related to how people will see you, what the society thinks, and all that, people do not seek help when they should. And then they try to solve their problems themselves, sometimes in the wrong ways, and then they end up with these problems. Then I just put this picture. There's no need talking about the neurobiology of addiction. I just summed it up with this picture. You can see this brain, it's healthy. You can see the drug user's brain. The spots, it just shows you like areas of brain metabolism and all. To sum it in a simple way, to summarize it, the use of psychoactive substances, it just hijacks your brain. It takes over the normal pleasure reward pathway, the normal way that your body should react to certain things, which are stimuli, which are pleasures. And it just hijacks the whole system, your neurotransmitters, everything. It takes over. Just the best way to sum it up. It hijacks it. And when you can imagine when the brain has been hijacked, the normal controls, normal breaks, the normal measures that should put certain things in check are all off, because now it's like running in rogue mode, if I would use the word, and then all the consequences that come with it, behavioral, physical, and all. So basically, that's what it does. And so we're talking about substance use, substance use. How do we identify substance abuse, substance misuse, however you want to call it? There are two major things that stand out. It usually starts small, maybe not obvious to anyone, but then it starts to become obvious. But who recognizes this is who is looking, or who even knows what to look out for. When you talk about altering a person's behaviors, why does it do that? Like I said, it hijacks your brain. The pleasure reward pathway that is in the brain has something to do with your frontal lobes that controls your executive functions, your behaviors, how you think, memories, everything. So all those things just translates back to what we now see as behaviors. So you see somebody who is increasing that, it's not typical for them, but they're increasingly becoming aggressive, irritable. You can just notice this change. Sometimes you cannot put your hand on it, but their personality, their attitude is changing. The level of energy, enthusiasm about things that they usually should be interested in is going away. They are having depression. I know that depression has been spoken about in these meetings, and their moods are changing. They are becoming withdrawn, sad, energy, all because of the talk. Because, like I said, these things, they affect the brain and the nervous system, and they have something to do with the chemicals that God has put in our brains that control our mood and emotions. So they start messing with everything, and then you begin to see the symptoms. Even the changes in their social networks, usually the getting involved in substance use just takes you down the negative pathway most times. Your social network, the friends who would actually encourage maybe you in better behaviors, are usually now not the company you want, because you want to be around people who can help you get what you think you need at that time, which is drugs. Changes in habits, priorities for those who are in school. You can notice like their attitude to academic work on its own. Involvement in criminal activity. Nobody sets out to get into this, but sometimes they do it just to be able to fund the habit, or because of the company where they found themselves. So Those are some of the ways you can identify behaviors related to substance abuse. Other things are like physical things, like seeing somebody early in the morning, bloodshot, or not even early in the morning, at any point in the day, bloodshot eyes, glazed eyes, dilated or constricted pupils, weight changes. Because some people, when they start using these things, tend to neglect healthier diets and deviate more to using substances which do not have any positive impact on their health. So they tend to lose weight, changes in hygiene, because at the end, you're neglecting basic aspects of your life, your functioning, your personal care, your health, social interactions, meaningful things, academic work, occupation. And so then you can see, because people are looking disheveled, they don't look as tidy as they used to, dental issues, most of these drugs affect the dentition. So, like, depending on what it is, some of them cause cavities, caries, and also decays, depending on which substance. There are just many in that category. And skin changes, probably because of the effect of the drugs or some of the drugs that they use by injection. All these things cause certain infections in the vessels in the skin and changes, and problems sleeping too much, depending on which, because like I said, these psychoactive substances, they mess up with the neurotransmitters you have in your body, which naturally have functions that they should do when they are in certain quantities. And because these not medications, these drugs are working in on those same neurotransmitters, they hijack it and they make them too much or too little, and then they just disrupt that normal architecture of things, and then you just begin to have problems from everywhere. So, like, when our ability to recognize these signs can help prevent the problem. It could be like you as an individual, it can be someone you know, but being able to identify these warning signs is key, because sometimes when people are neck deep in these problems, they do not realize they are, and they do not even know that they seek help. Sometimes it's the people who care about them, their friends, who actually recognize these things. So it goes either way. Ability for us to identify it in ourselves or in other people is key to us being able to access help. Like I said, like I also opened up on the slide, substance use problems, they are common, they are very common. They are like everyday things now, and they pose real public health challenges. So it's important to speak up and seek help as soon as we recognize warning signs in ourselves and others, so that help is available. Is one of those problems where early identification is key, because if you're catching somebody at the point where it's still use and not addiction, the the success rates, the progress in treatment, and the kind of impacts that and consequences down the road, you can halt it before it gets to that point. So it's actually very important that we identify these things early. And then when do you seek help? There's just a long list of what you can see at what point to seek help. But I would just sum it up like, if you recognize any of these symptoms, be it the behavioral or the physical, if you find ourselves or someone who's spending more time on anything related to finding, using and recovering from the effects of drugs, people like, for example, someone in schools missing lectures, missing work, it just is a telltale sign. Any aspect of their well-being, even if it's like social interactions, responsibilities in the community, interpersonal relationships, once you can see that it's being affected. And then when people are not able to cope without the help, you think you can't concentrate, you can't deal with anxiety unless you are taking something, or that's the only way you can cope, then no, it's time to seek help. Where can you find the help? Now, unlike before, there's more awareness on the problem. So even if it's talking to just your primary care doctor about what you're going through, even if the doctor is not skilled with what to do for you at that point, then they can refer you. There are mental health professionals in many localities now. Most teaching hospitals and federal medical centers now have a mental health unit. Their family care unit also, there's an increased level of awareness. So speaking to someone, it doesn't have to be at the point of this is you recognizing it like a problem. Just even talking to a primary care doctor, can he get you the right referral you need? Mental health professionals in your locality, in the teaching hospitals, most of them now have a mental health unit. Sometimes you will not know unless you ask. And if you do, you will actually get the information you need. That there are also helplines available now. So even if you're somewhere you think, I don't know where the federal institution is, I don't know where the teaching hospital is, you can call the helplines. Some of them I kind of will project their numbers. If you call them, then depending on your locality, they will tell you where to go. They can talk with you and tell you what next to do. So that's basically what I have, and thank you for listening. I have Acido Foundation here, their phone number, which I am part of. This is their helpline. It doesn't matter where in the country you are. If you call them, you will get help. They will tell you what to do, they'll tell you who to meet, where to go based on your locality. If you can't go to the help, they'll make sure that help comes to you. They'll make sure that happens. There's also something, but there's lots of them now available. So thank you.
Hello, were you
Hello?
here? Were you hearing me?
No, I didn't hear you now.
Okay, like what was the last thing you heard? I think my mic went muted at some point.
No, I didn't hear. Since I stopped talking, I haven't heard you say anything.
Oh, are you serious? Okay, sorry. I think I didn't unmute the mic. Okay, so I was saying, like, thanks for your lovely presentation. It was very simplified and straight to the point. So I also said, this is a very sensitive topic. Most people wouldn't want to talk about it. A lot of people don't even accept that this actually exists. So as someone who has contact with people living with sickle cell disease and my background medical knowledge, I'm going to ask you some questions just to strike up a conversation in the next 30 minutes.
Okay.
That just to explain some certain stuff that run through their mind that could also help. And one of that would be, what's the difference between drug abuse, no, drug misuse, drug abuse, and like when you say someone is misusing a drug or a substance, and when someone is abusing it.
Okay. Those sometimes people mix up those terms and they use them interchangeably. But to answer your question, it's when you talk about misuse, it's just like, and then what abuse? Like outrightly, you have, if I use an example, because I like to be as simplified as possible. If we think about prescription medications, which is a big challenge and a common medication or prescription or stuff that people with sickle cell disease abuse or misuse. If you are given a prescription for a painkiller, for example, because you have pain, that's use of prescription medication, for example. But then when you are taking those prescription medications in the context of nobody has prescribed it to you, it's just that maybe you've used it before, you know what it felt like the other effects you got, and now you've decided to be using that just to feel that way, you are misusing it. And
Okay.
then in that regard as well, then when you talk about illegal, illicit substances as well, example, marijuana, things that are illegal, the moment you're using those things, you're abusing them. I don't know if it makes sense.
Okay,
So it gets,
so
so it
so
just,
for prescription drugs, when you
for
use them without them being prescribed, that's a misuse.
that's the issue, and you're continued using it now, you're abusing it.
It now leads to an abuse. Okay.
Yes. But in the context of those terms, depending on the region of the world where you are, some people outrightly talk about these things as misuse, even when because you're using it in a way that is not intended to. Do you understand? And
Yes,
then, so that's what it is. But either way, abuse, misuse, those are they are like the foundation you lay to work yourself up to the point of dependency or addiction.
Okay, yeah, I was going to get there, but I wanted us to establish what misuse and abuse was. Okay, so when we've established that misuse is when you use a prescribed drug, for example, when
Or
it's in a way you were not asked to, just because you know it's being used that way. For
yeah,
example, people living with sickle cell disease, we all know that one of the prescriptions they give them for the pain medication is pentazocine, and
yeah,
someone decides to go and buy pentazocine over the counter just because the person knows that penta works. That's a misuse at that point, which
yes,
grows into an abuse.
yes,
So okay, for example, pain is like the main thing in people living with sickle cell disease, and that pain is what leads to the misuse, the abuse, the dependence, and the addiction. So
yeah.
what exactly is dependent, and when can you now say, oh, this individual is addicted?
Well, I don't like to use dependency and addiction as two different things. Actually, we try to stay away from using the word addiction because that word on its own has stigma attached to it, because you hear people say talking about things like someone is an addict. But the basic principle is, if you're talking about addiction, the person already has become dependent on the drug or the substance. So you can't talk about addiction when there's no dependency. So there, for me, there's no difference between the two. Because for you to become dependent on a drug, you've gotten to the point of dependency. There's actually criteria for that. There are a list of things, and I will
Okay.
go over them. But for you, there's no difference. So there's no point anybody trying to separate the two. But
Draw the
just
line between
yes,
dependence and
there's no
addiction.
drawing the line. If you have gotten to the point of dependency, then you're addicted. That's the fact.
Okay,
Because
so
the
in
dep-
simple terms, what is now dependent? At what
yes,
point do you say someone is dependent on a
there's
substance or
just
addicted to
like,
a substance?
depending on where you are, but the criteria are different. But there's like different things that will be going on for you to say that somebody has become dependent on a medication or on a drug of abuse. Things like, one, they are now developing tolerance. What is tolerance? They've used is such that you've started using a drug, and then to get you started using a drug, it gives you this particular effect. And then after a period of time, because your body has developed tolerance, you need to take more of that same drug to get the same desired effects. Does that make sense? So that's
Yeah.
one of them. So that's, let's say, example, somebody needed to drink like maybe 4 cans. I'm just going to use alcohol, for example, 4 cans of beer to get to a certain level of high, and now they have to take like 8 bottles to get that same effect. It's just like drugs of abuse. You've mentioned pentazocine. Sometimes people would have to just take one vial, maybe inject one vial of that, to feel a certain way. And now in a day they are using two, three, four. So I'm just trying to drive home what tolerance is. So you're finding yourself taking increasing quantities to achieve the same effect. So that's what happens when somebody is developing tolerance, and is a sign of dependency. Something else is withdrawal. So it's withdrawal symptoms start happening, such that if you do not take the drug every day, or whenever it was you take it, or the frequency you did, you can't function. Yeah, maybe in the morning or whatever, you're agitated, you're restless, you can't sleep, you're irritable. So these are the symptoms you start noticing in yourself when you have not taken it. So then you're beginning to have withdrawal. So there are other things like your now neglecting other sources of pleasure. Like, instead of you to, like, normally you have friends you interact with, you have other things to do. Now you're going to, on a scale, you're neglecting every other thing just for drug. You're spending more time finding sourcing for it, using it and recovering from it. What do I mean? What example can I use? For example, somebody that is in school, for example, is missing out of school because they've taken the they've taken the drug they normally take. It takes them a long time to get out of the effect and get their act together. And when they are out of it already, they're already feeling those withdrawal symptoms. They have to find it again to use it. I'm just trying to simplify it as much as I can. What are the other things? You're continuing to use it despite seeing the impact it's having on you. You're seeing how this thing is affecting you, yet you're still using it. So those are the core signs that you can tell is having impact on you, having health consequences, yet you're having legal problems, you're still using it. So that the things that you see, and you see this is, so now and then you're trying to stop the use, like you've tried to cut down how you're using it, but you can't even sustain that. You find yourself going back, and when you go back much neck deep. So those are some of the things that you see, that you say that this is now to the point of dependency. So I don't know if that answers your question.
Okay, so yeah, that has. So we've tried to explain misuse and abuse, and we've also tried to explain what dependence and what tolerance is, and how tolerance now progress to dependence slash addiction, since we're not separating it. Okay, now back to sickle cell disease. Okay, so for people living with sickle cell disease, a lot of them give you stories like the pain made me take more, or because of I'm tired of life, I'm taking the drug. But what exactly are there other things that causes people who live with sickle cell disease to start abusing substance? Or do you actually think that it's a question mark or a query in the management of the condition to start using opioids as a line of management for them? Or do you think it's not about the management, it's about the way they feel, or the friends they make, or the pain? What exactly do you think is actually like the baseline that makes people living with sickle cell disease more at risk, or who they have higher tendencies of abusing substance?
Okay, like I like the question you asked, and I'm going to go back to what we discussed earlier on in my presentation. There's no one answer to that question. Why is that? Because like when I talked about the risk factors for substance abuse in people with sickle cell, I try to class those things into personal and environmental factors. First, I'll start by saying that when I talked about the personal factors, I said that certain things made someone more at risk. Now, in the context of someone who is living with sickle cell disease is a chronic medical condition. There's also a lot of pain for some people. Some people are lucky, or let's use the word, they do not have as much painful crisis, but others do. So that is a chronic medical condition. A lot of people with sickle cell, they are in and out of the hospital. They have to deal with all that pain. Sometimes they get managed. Sometimes even before they get the help they need, they have endured quite a lot of pain. So as with other chronic medical conditions, it comes on its own with certain mental health problems like depression. I mean, for anyone who has lived through sickle cell, they can understand why. I mean, it's not like you must have it, but then the circumstances surrounding you. So a lot of people have those symptoms. There have been studies that have been done, and they found that there are certain mental health problems that commonly occur with sickle cell. So yes, a lot of people with sickle cell, they have depressive symptoms. The problem is that they do not recognize it. So they feel low, their mood fluctuates, some of them are anxious. So they have all these other mental health problems, which some recognize, some are identified, some are not. And in the case of it not being identified, they are dealing with the sickle cell that they have to, the painful crisis, and they are dealing with the emotional and the psychological things that they are going through, which nobody identifies. Because you ask me, do I think is this or that? That's why I said there's really no one answer to the question. Some people have that going on. So they have sickle cell and they have another comorbidity which has not been identified. And then I know you guys had a session where you discussed depression. Depression on its own has its own challenges. So that's like a dual diagnosis somebody has here. But the bad thing is it has not been identified. So the help they should have gotten for depression, for example, is not there. And then they find other ways which are like they are not helpful coping methods, because maybe when they had a painful crisis they received a certain medication. In addition to relieving the pain, it made them feel good or feel better. Then they try to use that when they're having symptoms of other things like depression or anxiety to relieve those symptoms. I don't know if it makes sense to you. Other times it's just that when managing painful crisis in people with sickle cell, there's a high level of caution. There are a lot of things that you can use to relieve pain in these individuals without getting them down this pathway. The problem it had always been that it's not that you cannot use opioid to manage painful crisis, but you have to use it and use it cautiously. I said this thing when we started. In our setting, you can easily get certain opioid-based medications off the shelf in certain places, which ideally should not be. It should be a case where someone with sickle cell needs this for pain and gets it for that, not gets it whenever and however, because then the person to abuse it is much higher. So it's a mix of different things. So it comes in with different things. It can also be peer pressure. Sometimes it's like you're talking about what you're experiencing, and somebody is like, a peer is like, have you tried this? It helps. And then you try it and it really helped in quotes, then momentarily at that time. And then it becomes your go-to thing when you're experiencing similar things, which ideally shouldn't be, because if you are recognizing that this is what I'm going to and you sought help the right way, you won't have to use those things which had addictive tendencies, because then the brain will remember how you felt the first time and it would want more. That's what we also leads up to what we're talking about tolerance. Because after some time, that thing that is not what you should have done, that substance which was helping in quotes, because it's not real help, is no longer helping, and you have to go head neck deep, getting looking for more just to get that same effect, which you will not get, but then you're getting deeper down into abuse and having the other problems that comes with it.
Okay, thanks a lot for that. And that's also pointed out the fact that availability of substance is also one of the issues
Yes,
involved in substance abuse. Yeah.
it
So yeah,
is.
so since you've established that, how can now generally people living with sickle cell disease have this communication issue? Why am I saying that? A lot of them don't know how to communicate how they feel. They don't know how to ask. They don't know how to communicate how they feel. They don't know how to express themselves and all that. How do you have like suggestions or like how people living with sickle cell, just in case they find themselves in an uncontrollable situation where they are seeking for these substances, or they've started using these substances, or they have this crazy urge to use these substances, like means of how they can be able to communicate this to maybe to a friend or to someone or to their doctor, because sometimes they actually want to communicate this, but they just don't know how to communicate. So with experience and with your expertise, is there any way that you feel or you think should work, or various ways available?
Okay, well, what you just raised is a very valid point, because now I'm talking from my experience, having dealt with a lot of people, not just those who have sickle cell, who have had problems with drug use. It's not, there are a lot of reasons that these things come up. Some of them is just because of how they view the problems that they are experiencing, and because of how our society is. At the back of all this, there's a huge role that stigma is playing in people coming out to voice out, because the first thing that comes to mind is they do not want people to judge them. They don't want anyone to say, so they rather just bottle it up. But then that was why we talked about where to get help. There's a difference when you talk to just anybody and when you talk to a mental health care professional about what you're going through. Sometimes you may not have to say all of it at once, but they have the training and the expertise that they need to meet you halfway until you're able to open up what you're going through. Because some people, like in my experience, I have managed some patients in the past who had sickle cell, who on their first attempt to say or tell someone what they were going through and what they were dealing with, what they got wasn't the support they needed. Or they got judgment, they got reactions they didn't. Do you understand? So that is one thing that is a big challenge for people trying to speak up. But then you can start by seeking help through helplines. Because then you call a helpline, it's a helpline. You're not seeing the person face to face. If you're feeling like you're not comfortable coming on one, because any help at all is better than no help. So you can start from there. If you're not comfortable coming to a point where you can sit down and tell somebody face to face what's going on, start with calling maybe one of our helplines. You call the helpline and talk to somebody. You can start. That is better than not getting any help at all for people who do not feel comfortable because of what they, for whatever reason, talking to people. Another thing is that when we say talk to, professionals. As a doctor, there are certain oaths we've taken, and whatever it is somebody comes and tells me, it's very confidential. So if you remember that, that's one thing I want to chip in. Just remember that we've taken that oath to confidentiality, and whatever you say at that point, meeting with a mental health professional, you're in your safe zone. You shouldn't, even though it's that voice at the back of your head that feels, what would this person do with this information? But it's not going to go beyond using it to help you. So I'm just going to encourage people, because there's really not much I can say about what they feel or why they are not speaking up that is going to not still be talked to somebody, because this is not one of those kind of problems you deal with on your own. If you have someone in your family or a friend who you feel you can confide in, then you can talk to the person. But if you're some of the people in a particular situation where they believe that there's no one they can talk to, then please just talk to a mental health professional. You don't have to be a one-on-one. If you're not bold enough or you don't feel comfortable enough to have that conversation looking at someone, then call the helplines and speak to somebody, because then you will get counseling, you'll get some therapy there, and then that can help you get to the point where and then you can know what your options are, because when you talk to them, you will know what support is available to you. You will know, okay, this is what I'm thinking, but this is not really what it is. So when you talk to someone, then it was because a problem that you've started talking about psychologically, there's this release you get by even letting out what it is you've bottled up right with you. And it's the first step to getting help. So if you've never considered it, if you're seeing yourself in this narrative we're painting, if you're seeing that these are some of the things that I'm dealing with and I don't feel comfortable yet, just call the helpline and speak to somebody before you take that step of coming in. Because talking to someone about it, you can get a lot of counseling, a lot of support that you can't even imagine that will help you to boost up your courage to take the next step. But one thing I'm going to say is, this is not a problem which you can do, which you can deal with on your own. It's not something you want to go in on. And there's a community of people, professionals who are willing to walk down that road with you. All you just need to is say, this is me and I need help.
Like the hashtag for this our event is talk about it. Yeah, we encourage everybody to talk about it, and that's the main reason why we're having these conversations, because nobody actually wants to have these conversations. And until we start having these conversations comfortably, trusting the system, that's the only way we can actually curb the whole issues that mental health brings to the table, living with sickle cell disease or not. Dr. Ugonna, please, can you just share the numbers on the screen? Like, as you're sharing your screen, just leave it on that slide so they could check on it. So those numbers on the screen sharing right now are numbers you could call. Remember, she said confidentiality is key in this business, especially in mental health. Something she discusses with her patient, discuss with her. Even if I'm married to that patient, she cannot tell me, because that is what the business of this game says: confidentiality. Everything you discuss with your therapist is confidential. So we should try to express ourselves. We should try to talk about it. Just as we're wrapping up, I would like to have this should be the last conversation I'll be bringing up to the table. So have a lot of people living with sickle cell who have had addiction issues, and I try to help. I try to be the listening ear. I try to see how to help them, and I also try to link them to institutions that can give them further help. But I keep having the same thing coming up. Oh, I can help myself on my own. I know how much I use a day. I know the limit I can go. I can control it. And you realize that most of them just assume that they can actually control it, so but they don't seek the help. And then they don't seek the help. They will tell you they were using 4 ampoules per dose and now they've cut down to 1 ampoule per dose. And then you realize that they still go back to the same sites they've injected themselves and injecting themselves and injecting themselves. And it's so sad that they turn into serial beggars. They go on social media handle, tell you that they're having sickle cell, they are dying, they don't have money for drugs, you should send them money. You don't even know that you're feeding their addiction habits. So what exactly do you have to say to those individuals who feel they can handle addiction or substance abuse by themselves? Like, what's professionally, maybe if I'll be talking, they'll be like, oh, you're not a mental health specialty, you don't know what they're talking about. But what professional help do you think you can speak out to those people that feel they can handle addiction in sickle cell by themselves? And what are the various management modalities? Just for example, I know there's institutional care, there's home visits, there's psychotherapy, there's occupational therapy, and the rest. What are the options available? So maybe if you just state the option and give a small explanation of what it is, it may give them insight to what it is, because some of them feel they can be at home and then they just get better. So even when you're telling them that institutional care is the only thing that can help them at this point, they don't believe institutional care works. They believe they can actually control it. So what are those options? And what do you have to say to those who feel they can actually manage it on their own? They can cut down on their dose on their own and all that.
Well, what this question asks is actually is a reality, something you see everywhere with a lot of individuals. But then, like up until a few years in the recent times, at the definition, like when I started, addiction was redefined on its own to be a chronic and relapsing. Because then the reality is that even now, when you have 10 patients who have substance dependency and they come into treatment, it's just a certain number that will go on with the treatment and be fine. A good number of the others will keep relapsing, but they come in. It's like it's a journey. You just have to keep at it. Why? Because the brain has become scarred by substance use. The, like I said, it's hijacked the brain, is modifying. It's like just the way it took a while to get you to that point. It's going to take that same kind of journey, but now it's better because you're getting interventions. So all the consequences, all the side effects, all the impairments you're going to suffer in certain aspects of your functioning when you have come into treatment, those things are curtailed. It's not about how many times people say that they can do it on their own. When it comes to dependency on drugs of abuse, when it comes to addiction, it's something that you cannot go alone, because it's past that point of I can do it by myself, and these substances have hijacked your brain circuitry. For many people who have said so many times that they can do it on their own, what is the statistics? How far really have they gone in that journey of doing it alone? You can do something over and over. If you're getting the same results, you're not then that probably you're not doing it how you should. There's a community of people out there to help you. If you really, and the thing with managing substance addiction, substance dependency, you have to get to the point where you're willing to accept the help, because it's not an easy journey. It's not something that is forced on someone, but the help is there. That's why we're still speaking out about it. You don't have to suffer by yourself. You don't have to walk this journey. There's help, there's treatment, there are options available that can help you. So I'm still going to encourage you and say that there's a community of people out there to help you walk this journey. There are a lot of things that you have access to support that you will not when you're going it by yourself. When it comes to what are the options, there are different options for treatment when you're talking about drug dependency, especially people with sickle cell. It depends, the options are just varying depending on what. Some people want to get to the point where they outrightly you don't use these drugs anymore. That's when you're talking about abstinence. Some, you want to take away these drugs that they are using, which is having so many medical, psychological, and all whatnot complications, and replace it with something safer. But most of all these treatments will happen, or what type of treatment you get will depend on what your peculiar situation is. It's not like a situation where there's one shoe that fits all. But how do you get to the point of knowing this is the best decision for you? You have to speak with a mental health care professional. You have to be assessed. There are a lot of assessments that will be done for you. And when you seek help, you have access to those things. When you've been assessed, yes, some people will have to go into outright drug rehabilitation. Why? It's not because somebody wants to incarcerate you or lock you up somewhere. No, it's because at the initial phase of your treatment, we want to separate you from access to these drugs, to these substances that you have had easy access, or more so in our setting in Nigeria, where all these things are readily available. Some people can tell you that just at the end of their streets, they can get whatever it is that they've been using. So, what sense does it make managing you in that setting in the initial period where you need to be detoxified, and have your body like the effects of those things in your system clear out? So no, you have to go to a setting where you will not be able to access those things, because if you will crave for it, like craving, you really want, it's a very big problem when you're talking about dependency on drugs. When you start craving, sometimes people are not able to control it with their willpower, because again, it has hijacked your brain. So the treatment options are different based on an individual situation. So you might have to go into full rehabilitation for a period of time, and then after that you can do outpatient management. There can be halfway home, like have meet you halfway, like in the community. But the thing is that all the options we read about that are available in other settings are not all available in our setting in Nigeria, but we have things that work going on. So some people are at the point that they are already dependent. Some people are at the point where they have not gotten to that point. Some people have just entered this pathway and they haven't gotten to that point. So what I'm trying to say is that the treatment you get, it's just depending on at what point you are. And we can't say what point you are until you make that stop and talk to or see a mental health professional. But then there are drug rehabilitations available for those who are at the point where they need to go through rehabilitation. There are substitution therapies, and there are other therapies that are available. But what you will get, it depends on your peculiar situation, which you will only know when you have been assessed by a mental health care physician.
So yeah, in summary, Dr. Ugonna is trying to say that except until you are being assessed, you can't really know what works for you. So based on your assessment, based on the stage you are in, whether you're in the early stage or you're in deep or you're in the dependent, tolerant, or whatever, it's based on the assessment when you seek help. And that is now the basis that now forms what's management you get. So you can see, you can't stay at home and say you're helping yourself, you're cutting down on your usage. No, until you are assessed. It's just like you go to school and then you write exam and then they give you CA for you to do, and then you write exam and then the teacher is trying to assess your knowledge and all that. Or at the end of this section now, I now do a quiz and ask you guys to tick. That now makes us know, oh, if we've been talking jargon since we started this section, or if you actually assimilated. So mental health is not like having malaria when you go and do, even malaria, you get assessed, right? Because after you do the test, the investigation is a form of assessment. The doctor asks you questions. Do you have fever? Do you have headache? They are all forms of assessment. And then when you do the investigation, like malaria, you have MP+1 or MP+2. Those are also forms of assessment. Someone who has MP+1 obviously has mild malaria compared to someone who has MP+2. So at the end of the day, without being assessed, you can't even know the extent to which how bad your case is, or how you walk down that road. So we should remember to talk about it. I don't know if anybody has any question. Please use the chat box to ask your questions. It has been an amazing section. Yeah, she tried a lot to throw light on the need to talk about it, and it's really important because yeah, people have depression and all that, but in sickle cell disease, I think addiction is like the main thing because of the use of opioids and the misuse of opioids and the access to opioids. You know, you can even buy it in any shop down the road, as she said. So we should talk about it. It's always important. If you cannot talk to me, you could talk to, I don't even need you to talk to me, Steph. I'm going to send you, if you tell me you need help, I'm going to refer you to a lot of mental health physicians out there that are ready to help you. Or you could call any of the numbers on the screen. We should talk about it. It's very important. Thank you very much, Dr. Ugonna, for making out time from your very busy schedule for us today. I know it was really a very tight corner I put in. Thank you very much. I knew you were the best for this topic, so I had to pull you out to do it. Thanks to everybody who joined. I know we had a very stressful day, but thanks for actually joining. So if you have any question, you could ask me later. I could contact Dr. Ugonna and drop the questions for her to answer. And then if you find yourself in the situation and you're using a substance, just know that it's not like you're bad or you're evil or you're taking down the wrong road. It's just circumstance that happen based on the condition you have. And then there's a way out of it. But that starts with talking about it. So Dr. Ugonna, do you have in the last words for us before we call it a day and wrap up?
I just want to say thank you for having me, and again, talk to someone. There are people who are willing to walk this journey with you. We're always eager and willing to talk with you, to meet you wherever, to help you. If you're already in this situation, nobody is blaming you. This is not like a blame game. It's already happened, and we're all looking for a way to change your story to a success story. That's why we are in this profession, because we always want to meet people wherever they are and bring them to the point where their mental health is top notch, where they are functioning well, every aspect of their life is working the way it is. They are maximizing their potential and their abilities, because there's really no health without mental health, mental well-being. So if you can identify yourself in any of the situations we've talked about, if you recognize any of these symptoms in somebody you know, don't feel like you don't have anyone to talk about. We're the last people to judge you. We're here to help you. This is what we do. And there's help available, which is why we're saying it out loud to anyone who can hear. There's help, there's treatment. So make use of this opportunity. Things are changing. It's not like before when there was nothing to do. There's a lot of people are becoming more aware. We're trying to advocate for people, reach out and say, this is us. We can't keep having this huge burden of people in Nigeria who need help and they are not getting it, because now there are young people like you who are in this profession and that they're out to help you. So speak to somebody, talk to someone, reach out to the helplines. Most of the institutions have mental health units. Come just the way you are and you find out that there's ample help available for you. Thank you.
For those in Rivers State, UPTH has a mental health team there, and UPTH also have a drug rehabilitation center. So for those in Rivers State, and then you could ask me for the other states you're in, I could find a contact and let you know. Thanks very much. We'll be back next week, Saturday, 6 p.m. We'll be talking about support systems. That's another topic we should actually talk about. So now we've already realized that we need support systems for us, because from all Dr. Ugonna has said today, everybody needs a support system. So we hope you join us on the conversation on support system next week. Thank you very much, Dr. Ugonna. Have a lovely day. Bye,
You too.
everyone. Thanks for
Bye.
joining. I really appreciate it.